healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
Welcome back to another episode of Coffee with Coker. Thank everyone for listening. On this episode, we have some new folks that have not been on the podcast before, and we're talking with a couple of gentlemen from a company called PREMEDEX. And we have Willis, Charlie Caperton, and Jim Bowling. They are all executives there at PREMEDEX. And we talk a little bit in this episode about a number of different things, and specifically relates to the idea of different types of strategies for patient engagement. And it's also in the context of telehealth. So a lot of what PREMEDEX does is tied to telehealth, virtual care, remote patient monitoring, and those types of things, which obviously we've been talking a lot about lately for sure. And we also get specific to some of the things that they are seeing and having to respond to with their customers that are mostly hospitals and large medical groups. And kind of the wake of everything that's happened with COVID-19, shutting down of many different facilities or reducing volume significantly through less elective procedures. And we talked a little bit about what that's looked like, but more so we wanted to focus in on looking ahead and kind of what this means, what all of this stuff that has transpired for the last few months now, as we record this in June of 2020, what it's going to look like going forward as we hopefully, come out of the pandemic era and we go into what is commonly referred to as whatever this new normal is going to be. So that's what we talked about with Van and Jim and Charlie. I also just want to mention, just in case anybody has any questions, and so everyone's aware, Coker has no financial relationship with PREMEDEX. We're not here to sell PREMEDEX. We're not trying to push them to anyone. It is purely something that we have seen and wanted to partner with them for creating value for our clients. When we find something that we see can have meaningful, substantive value for the clients we serve and work with on a day-to-day basis, that's something we want to talk about. So there's no benefit here for Coker other than having a conversation about hopefully things that may be of value for the clients we work with. And I just wanted to mention that because I don't want that to be unclear or any questions of transparency there. So we thank you all for listening. We hope you enjoy this conversation. We always ask that you subscribe if you want to hear more of these types of discussions, and if you like this type of content, please tune in. You can find all of our episodes of Coffee with Coker at coffeewithcoker.com. And again, you can subscribe on all the different platforms and submit questions via the website or recommendations for future topics. Or if you want to find out any more information on any of these people, that information will be available in the show notes. But we hope you enjoy this conversation. Thank you for listening and look forward to talking more about this in future episodes. Enjoy. All right, well, welcome back to the episode. And today we are talking about a number of things that still in the theme of stuff that we've been talking about really for months now. It's hard to avoid talking about the big things affecting healthcare providers in the wake of COVID-19, and really, more importantly, looking forward as we come out of this very unique experience and dynamic in the country and the world, but specifically within the healthcare system, and thinking about looking forward. And so I'm glad to have all new guests today. And as I mentioned in the intro, we have Jim, Van, Charlie, and Russell joining us. We've been working alongside PREMEDEX for some time now as we kind of help our clients navigate some of the unique challenges they're facing. And there are a few things that we're talking about here. I guess globally, you could tag the theme and topic of telehealth, but really it's much more than that. It's not just telehealth. There is a telehealth element to this, but it's a lot more. And so maybe as we get started, Van, I'll throw it over to you. If maybe you could just kind of set the table or provide a little framework, high level, for where PREMEDEX falls as far as the healthcare ecosystem, some of the things that you guys do working with your customers?
Yeah, sure, Mark. Thanks. And glad to be participating in the podcast with the team at Coker. But where PREMEDEX fits in is, we look at major trends in healthcare. We see the shift to value-based care as one major trend, of course, that's talked about a lot. And then we also see a very increasingly competitive marketplace as physician groups are acquired by health systems and health systems are acquired by health systems. So a consolidation going on there. And so the need to stay connected with patients is more important than ever. And that is where we come in and help facilitate engagement, communication programs on behalf of our health system clients with their patients. There's different focus with different groups, but certainly a primary focus that our clients have and we help them achieve is driving revenue growth, demand generation, et cetera. For others, though, there's a big focus on, particularly now as we're coming out of this, unforeseen circumstances of the pandemic, but cost containment, really being more aware of penalty avoidance, et cetera. So there's different paths to success for our clients, and we create robust patient communication programs that help them stay connected to patients. Typically, they want to improve the experience, increase retention and patient loyalty, drive additional revenues to really optimize patient visits, and avoid penalties that may be associated with their contract. So we've got a very sophisticated messaging platform that includes some of those things like you've already mentioned, and we'll dig deeper in, I'm sure, throughout the course of the conversation. But the routine communication and outreach up through telehealth, remote patient monitoring, et cetera. So patient connectivity in between hospitalizations and office visits is one of our key areas of focus.
I think that sums it up well. And one of the things I'll say on behalf of Coker is when we work alongside other firms, other companies, whether it's a technology vendor or services provider or anything else, we want to align ourselves with organizations that we can see providing value to our clients, true value, value creation and, growth opportunity, but not just kind of a new technology for the sake of new technology. And I'll say that's, one of the things I've really valued about you guys. And you mentioned a couple of things there, cost containment, talk about value-based care, which obviously is, going to continue to grow and expand and take on kind of new forms. One of the other things that I know you all are kind of in the weeds on with your customers is things like patient engagement and patient access, things that we've talked about and we regularly work with our clients on in different ways all the time. And maybe, speak to that. And Jim, maybe if you want to jump in here, but when it gets down to your involvement in the working with your clients on as far as managing patients on a daily basis, what does that look like? And what's kind of happening there as far as trends? Where are we now? Where has it come? Looking at from a volume perspective, and then maybe we can tie that into where we think it's going to look like going forward and where you guys fit in there.
Yeah, sure, Mark. So, we really look at ourselves as extenders to our clients' teams, and they are really limited oftentimes in time, technology, and resources. So we step in with the right technologies and the resources to help them achieve the results that they're looking for. And our programs are designed around engaging patients outside of their facility, beyond the four walls of their facility during care transitions. And we initially started with a patient experience focus and HCAPS, and we have moved more into revenue driving activities because a lot of our programs can now be compensated for, reimbursed for by Medicare and other payers. So we're really going in, doing the data analysis with our clients to determine which programs they should implement, how to measure the success of these programs, drive revenue for them, and also achieve the other quality metrics that they're looking for. But as Van mentioned, right now is a critical time to drive revenue. And so we're still able to achieve the same other quality objectives as we were before, but now looking to drive that revenue and drive revenue that they've lost over the last 6 weeks to 2 months or so. We have seen a significant decline in our volume, as you would expect, and we lost about 60% of our total call volume or engagement volume over the last couple of months, and now we bounced back to about within 30% of our typical volume. So we are seeing that increase. We do expect that to increase even more this month. So it has been a real adjustment for us as we've kind of pivoted some of our programs that have been around cost containment and really using the exact same programs to manage COVID patients as well as position our clients for revenue growth.
And I like that as far as revenue driving opportunities. And you said it better than I did, because I think, what previously, and I think some of what you were alluding to was some of the new coding rules that went into place even prior to COVID-19 coming out, and then some of the loosening of restrictions even since then. But it's more than just cost containment, and there truly are revenue driving opportunities out there, and that's what these organizations are going to need. Like you said, we've seen all across the board volumes drop, because when you're not doing as many procedures, and elective procedures have for a time period there and completely went away. In some places, they haven't really come back online as much. And even it's still where they have, they're still coming back slowly. So, we know that's a trend that's wide scale. But as we think about some form of recovery, those revenue driving opportunities are going to be key. And, I'm curious, I know one of the things we've talked about before, when we look at different pockets where, some regions and some organizations within certain areas have really been hit harder than others. And, I think about, I know you guys work up in the New York and New Jersey area, and maybe Charlie, if you want to chime in here, but, maybe talk a little bit about what it's been like kind of working with organizations in those really acutely hard hit areas as it relates to COVID, and then what that's going to look like as far as, emerging out of this and rebuilding to a certain degree going forward.
It was pretty amazing to watch how quickly the volumes dropped off, particularly really across the country, but New York, New Jersey were particularly hit hardest. And as Jim mentioned, we saw the volumes go down pretty significantly as they transitioned a lot of the units to COVID units, and it was it happened quickly, and I think that fortunately the recovery is coming pretty quickly. It has taken a little bit longer in these areas in the Northeast, but it really gave us an opportunity to look at referring back to the driving revenue. It really gave us an opportunity to push out and get acceptance for remote patient monitoring and telehealth. The relaxation of some of the codes and copays, allowing patients to really be seen virtually, literally, and bill the same 99213 codes and type office visits, whether it was done in the office or virtually. It was really, an opportunity to transition to a virtual environment. And with the relaxation of the copays for remote patient monitoring, you could really help these big health systems drive revenue where they were losing it profusely, and sort of fill up the virtual waiting rooms give them an opportunity to bill for remote patient monitoring, get devices that were really easy to use, blood pressure cuffs and pulse oximeters and the like out to patients very quickly so that they could begin to see patients, care for these patients and bill for these patients. So, where you saw health systems that were just really hurting because they were having a hard time, with not seeing patients. I mean, they were virtually, some of these hospitals were empty except for the COVID units, and their owned physician groups and were just the waiting rooms were empty. We heard things like our physician practices, our primary care docs, they're at 10% capacity because quite honestly, patients couldn't or wouldn't come in to see their physician. So we really had an opportunity to push out, as a patient communication company, we really had an opportunity to push out remote patient monitoring and telehealth as an option to help stop the bleeding, if you will. And so, it became an opportunity to help our health system partners drive revenue, as Jim and Van mentioned, in an environment where that was tough. So yeah, it's been interesting. It's nice to see that the hospitals are filling back up and procedures are being elective procedures are being turned back on. Our post-discharge call volume is increasing every day. We had an internal call yesterday where it was just amazing to hear how our post-discharge call queues were just coming back with a vengeance. And so, we heard terms like the surge for these elective procedures. I mean, look, it may not have been an absolute necessary life or death thing, but if your knee's hurting or your back's hurting or there was an opportunity to really rush back in to get these procedures back online. But it did give us an opportunity to really support our remote virtual care products while we couldn't see those patients. So great opportunity.
Well, one of the things you said there was that struck me was or alluded to the billing piece. And I know, Coker did a survey, a market study on telehealth April and May. And one of the things, the feedback we got definitely was a much higher adoption. And this was broadly speaking telehealth, but so a range of kind of virtual based services and interactions. But there were still significant questions and, direction needed as it related to coding and billing. And I know that's one of the things we've talked kind of alongside you all with is, providing support around how do you code for these services, and not just in the midst of a pandemic, but as we come out of this. And, regardless whether we like it or not, I think telehealth is here to stay. And even without social distancing and all of that, we're still going to see a lot of these encounters happen via technology, via remote, virtual kind of environment. So it's going to be critical that the coding from a compliance standpoint is correct. And then the billing, as far as efficient billing goes and taking advantage of those revenue driving opportunities that's where the coding and billing pieces are going to be very critical. As we think about, as we dig in a little bit more, so I want to talk about kind of go back maybe a little bit, some of the things, Jim, you talked about as it relates to patient management, because that's a pretty broad term, right? So maybe break that down for us. What does that really mean as far as in terms of kind of PREMEDEX's perspective? And what are some of the things, I guess, maybe to kind of be aware of when we throw that term out there of patient management?
Sure. So, our core and kind of 80% of our core business typically, or in the past, kind of in the beginning of PREMEDEX, really focused around transitions of care. And in particular, we focused on TCM, that billing opportunity. And we really see that as a critical point in the recovery of a patient. So if, TCM requires a call within 2 business days of discharge, it requires appropriate documentation, and then it requires an office visit within 7 days or 14 days based on acuity. So a lot of our clients just don't have the visibility of those discharges and the staff to take timely action on the follow-up. And that's been a key part of our business, is following up with patients, determining how they're doing in their recovery, gathering important feedback regarding their service and their experience with the provider, and then helping them with their next step in the recovery cycle. And that typically starts with a follow-up appointment. So we make sure that they have their appointment, they have their medications, they have transportation to their appointment. A lot of things that can really adversely affect a patient during that critical time. So we are looking for intervention opportunities and escalating issues back to the appropriate care team members. That could be somebody in the hospital. It could be someone in their patient experience team or clinical team, or even at the doctor's office. So we build all those protocols into our platform, and it allows us to manage a large volume of patients over time. You can keep track of them, whether they're on a 1-week program as we look at them post-discharge and manage them, or a 4-week period in the case of a penalized diagnosis. But that's really just the beginning of the care management cycle as we consider it. And that's a key point where we look to onboard or on-ramp other solutions. So at that point, remote monitoring can be introduced. We can also discuss chronic care management, ongoing follow-up with patients, that monthly engagement, and that's a good time to get them introduced to that program and the benefits of engaging a care coordinator every month. And so there are about 200 CPT codes that we manage from that point forward. So it's a really critical time and a great point to introduce new programs that can be managed on a monthly basis. So we kind of use that TCM as a critical point in a patient's life cycle. The other critical point we look at if they're not transitioning from the hospital is annual wellness visits. And that's another time where the patient is going in to see their physician, discuss their plan of care for the next 12 months. And that's another a key point where we can introduce remote monitoring, chronic care management, and many other programs around their specific needs. So we feel that those are really the 2 linchpins of the care cycle, and then we fill in all the gaps from the other, from what we discover and our data analytics, looking at patients and where they have needs, where the physician wants us to focus, and then we carry out all of that between their office visits. So that's really kind of how we manage the care cycle, and all of those communications and coordination that has to occur to allow physicians to bill for our services, and also, of course, having a better outcome for the patient as a result of that ongoing follow-up.
A couple of things there that you mentioned that jumped out at me. I think the full kind of coordination and management of that care cycle, I think, is critical, and it will be now, in my opinion, more than ever. And the thing I like about it is there is a revenue kind of opportunity there, trying to keep patient engagement up, continue to keep patients in the network, in the system, but also, kind of combating attrition and things like that. But there's a quality element there too that is critical to that care cycle. And that's not just fluff, right? That's something that is very important. And it's only going to be more important when we do get into kind of a more of the normality of virtual visits. I'd like to shift and allow us to talk a little bit more. What I alluded to earlier is kind of looking forward, specifically coming out of a very, again, unique, unexpected, obviously, situation with the pandemic. But as we think about coming out of this kind of crisis and we look at recover and thrive, not just recovering, but thriving in this quote unquote new normal, what are some of the things y'all are looking for there?
Well, we definitely think that there is a new normal, and as we talked about before this, it's kind of an overused phrase, but we think that moving forward, everybody in healthcare has experienced visits and engaging with their providers in a different way during this COVID crisis. So I don't think we'll ever go back to all office visits or majority of office visits like we saw before. I think patients now see telehealth and remote monitoring as a viable option in their plan of care. So while some things definitely need a face-to-face visit, I think there's now greater appreciation for the options available through telehealth and remote monitoring. And I think even in addition to that, not just the convenience factor, but the revenue generation is really key. So I think we'll see proactive care moving forward take a giant leap forward.
Yeah, that's that. I would tend to agree. I think there's still going to be a number of gaps that have to be filled in, gaps that were already there pre-pandemic, and then kind of, whatever this new normal ultimately ends up looking like, there'll be kind of a continued evolution of refining that and hopefully improving it. And, I think that's where organizations like us, PREMEDEX and Coker, want to be with our clients, right? I mean, that's ultimately kind of why we're here. Maybe talk a second, maybe Van, I'll let you jump in here, and Charlie, feel free to jump in as well. But drill down a little bit as far as some of the other programs you are working with your customers on, and the programs you have in place where you're able to create value for your clients and other hospitals and health systems out there.
Yeah, Charlie, I'll start and you can round it out. But as we alluded to earlier, certainly we love the transitions of care. Patients, one of our overarching philosophies in our own company is it's the right thing for the patient. So think about a loved one, parent, grandparent, et cetera, that may have come out of the hospital. Healthcare is complex. Where do I go and what do I do next to hopefully not go back to the hospital or have a better recovery, et cetera. So we love that communication and think that at the time of discharge, something for the most part very challenging has probably occurred in that patient's life. And so we offer a transitions of care management program. Everybody knows it's a good idea, but a lot of times, again, going back to Jim's point, time, technology, and resources aren't there. Healthcare is very reactive. We've got new patients coming in the hospital. How can we give those patients going out of our hospital the attention they maybe need? But now that transitions of care program has become more vital to the success because it improves outcomes for your quality metrics, which drive reimbursements. And the transitions of care, et cetera, can drive top-line revenue into your physician network. So I think any chief medical officer in America would say, hey, every patient coming out of a hospital, whether it's inpatient or emergency department, needs a follow-up physician appointment to see how they're really doing. And we really work to bridge that gap on that transitions program. So it drives downstream revenue. It makes sure patients are more compliant to achieve better outcomes and keeps patients within the network. And then we've made that leap, as Jim mentioned, from the acute care side back into the physician network side. and have a lot of exciting programs that I'll let Charlie talk about from pharmacy and annual wellness. But before I jump off, the other side of the hospital part of the equation is the emergency department. You've got huge volumes of patients that come through these emergency departments. And how do you really take the best care possible of those patients and add them to your customers for life list, so to speak? So many patients coming in the ED, maybe they don't have a relationship with a physician yet. And you've worked hard as a health system through the years to build a physician network. So how do you match these patients coming through the emergency department with physicians in your network where they can get their ongoing care and build those relationships for better healthcare for the person, but also drive revenues for your system that you need to remain profitable and open to serve your community. But so that's kind of the hospital side of the equations on two things we love to work on: transitions of care for both inpatient and ED. And then branching on out, I'll let Charlie, talk to a few of those great programs.
Yeah, no, appreciate that. So we talk about the 4 Ps, if you will, internally, and that's new patient acquisition, patient experience, patient retention, and patient loyalty. And I think we've built some really great programs around those 4 Ps. As Van mentioned, the ED program, tremendous volumes of patients that you as a health system, you take great care of and then send them home, kind of treat and release. Well, we've got an unbelievable program that sends them a quick text after they've left the emergency room that says, "Hey, thank you for letting us treat you. And we hope you're feeling better." A couple of questions are involved in that text. It's an interactive text that can kick over to a live call. Question 1 could be, did you have a good experience? Question 2, it's best practice to follow up with your primary care. Do you have a primary care, or would you like us to schedule one? So, really taking a patient that's just had great care from the health system and allowing for an opportunity to get them scheduled with a primary care with a network so that they do the right thing and follow up with a doctor after they've been discharged. And then, did you pick up your medication? And we have great pharmacy partners that in the event that they didn't pick up their medication or they couldn't pick up their medication, that we can help deliver that to them once they're home. Our discharge programs, as Jim and Van mentioned, the transitional TCM, transitional care management calls that we do post discharge just really help drive experience, a better experience, better outcomes for the patients, healthier, happier patients that do not readmit. We've got readmission issues within a lot of health systems. I think that being able to help in transitional care and really making sure the patient doesn't wind back up at the hospital ED within 30 days is very important. In that better patient experience helps to drive patient retention and patient loyalty. So these discharge programs are remote patient monitoring. Really, if you look at PREMEDEX as a total patient communication platform to really help drive, again, the 4 Ps: new patient acquisition, patient retention, patient experience, and patient loyalty. That's at our core. At our core, what we are is a really robust patient communication platform to really help drive patient experience, drive down readmissions, improve outcomes, and we really appreciate the relationship with Coker, because these are complicated things to roll out, and being able to really partner with Coker to have a well thought out process for rolling these programs out is is very important. There's a lot of change that goes into this. When you're talking about, let's just say, identifying patients for remote patient monitoring and the coding that goes along with it and the complexity that's involved in really changing. We made a quick change to telehealth, and a lot of physician groups did. What's the long-term play here? And there's going to be a lot of thought that needs to go into that. And I think that's where using the expertise of Coker and the platform of PREMEDEX is really, really an awesome, powerful thing.
Yeah, I think it's interesting. You talk about those 4 Ps, and they cover a lot, right? A patient communications and patient management platform is something every organization needs and probably has some degree or some varying things. But if you think about kind of going forward, patient acquisition, it is a very new dynamic, or there are new dynamics, new variables involved in patient acquisition. Patient experience, it's very different, right? And many of us have in the last few months had some sort of encounter as a patient in a virtual environment. And that experience played into, or likely will have a significant impact on the retention piece, right? The idea of retention going forward is there's going to be, again, some very unique new variables to consider there and to adjust for. And then loyalty comes right along with that. That experience is going to have a direct correlation to loyalty and what the next experience is. And when we think about, I, as a patient looking at something like this, I appreciate the engagement piece. It makes it easier for me. It also makes, it's clear I'm a priority, and, I'm being addressed. These encounters are happening in a well-managed, organized manner. And that does make a big difference on retention and loyalty and the overall experience. So I like that.
Yeah. I think it's important to point out, these are, hyper competitive times, and being able to really drive those, patient experience, patient acquisition, keeping the patient retention, driving loyalty, patient loyalty. Those are all important because, you've got super competitive markets, and you want to, be able to keep the patient in network. And then on top of that, the reimbursement around the patient. HCAP scores and patient experience, while they, are very important around reimbursement. And again, driving patient outcomes and reducing readmissions. These are return on investment, conversations. It's a big topic, and I think it's important. We kind of put a little hold on things during the COVID time period. There's big shift over to remote patient monitoring and telehealth, but the pendulum's going to swing back, and hopefully we'll have a new norm, but it will just include a blend of what we kind of moved to during COVID, and then blending in with the pre-COVID, or I think the new norm is just going to be more efficient and more patient-centric, and dealing with patients in the environment that best suits them, and then making sure that they have great outcomes and stay loyal to the system. That's going to be the new norm, I think.
I would agree, and I think that's probably likely the case, is that it will be kind of a blend. But by the same token, I also think that adjusting has become the ability to make adjustments and to remain, as cliche as the term is, dynamic, and as far as responding to market changes and competitiveness, as you mentioned, all the more important. And I got to think, as we kind of round this out, and Jim, maybe I'll throw this over to you, but I have to think, when you're out there talking to hospitals and health systems and groups, that you probably get a lot of feedback, such as, well, we have our own call center that handles post-op communications or post encounter engagement, things like that. Or we have some sort of system, our EMR system does that, or, it's supposed to do that. And so maybe just kind of speak to that as we think about, again, creating value and taking advantage of opportunity, how you guys fit into that whole kind of being flexible, dynamic, and being able to adjust in a way that is hopefully not like having to turn around an aircraft carrier.
Well, I think you nailed it with the term flexibility. That's really what we provide. And as we've mentioned several times before, it really is a balance of time, technology, and resources, or people, process, and technology, maybe a different way of saying that. But and it really is it requires a very choreographed implementation to maximize the quality opportunity and the revenue opportunity. And I think that's where, when we go talk to clients, they often will tell us, we're already doing this. These are things that we're already engaged with. And after we kind of peel it back a little bit, we find out that they're only really scratching the surface on the opportunity. And while they are making a great effort at doing these things, there's no roll up in reporting. There's no way to see visibility and metrics across the programs, how things tie together, how they're really impacting ROI, and how they can connect these programs to a measurable increase or improvement in performance. So I think that it really comes down to that term flexibility and the power of the platform to quickly implement and track success of programs, and using a mix of technologies. I think that's the other part of it is there really is a blend of automated technologies and live resources, text messaging, IVR, automated communications, and various other formats that work together to engage a patient. So I think when it comes down to it, one of the key differentiators is contact rate. How many patients are we actually able to reach and engage with and drive meaningful results with? And that's where we see the biggest gap. There are a lot of hospitals and health systems that are doing a lot of work around these areas with their own call centers, and we certainly are able to help them or provide input or maybe extend their services if they need it. And many of those health systems are coming to us using our platform in their own call centers. So what we provide as a company is that platform, but also the services, the clinical and non-clinical staff to actually run the programs and monitor the success.
Yeah. Well, and the thing I think is interesting too, and again, as I've said or alluded to, we prioritize the need and importance of patient engagement. I think that one of the key pieces to that is coordination and integration. And so I think about things like that Van, you alluded to, Charlie, as well. But, when we think about ED transitions, coordination and driving pharmacy revenue and integration there, we think about the annual wellness visit piece, which ties to the employed medical groups and the CINs and the ACOs. And then you could probably extend that on to many other things. That level of coordination is absolutely something that's going to be critical as we continue down the road. It's always been important, but I think those are going to be some of the things that really contribute to that competitiveness piece, and as well as taking advantage of those revenue opportunities that are out there today. So I think that is, I think that those are things that we find very important. And that's why I think, as relates to Coker's priority on patient engagement and patient access, these types of resources and solutions are critical. And that's why we like it. Guys, I really appreciate, like I said, I think a very relevant topic for what Coker does as far as finding and assisting our clients with solutions and services and other resources. And did I miss anything though? Is anything as far as a closing point that maybe we missed something? I don't want to cut off too short if there's anything we missed.
I'll just say one thing real quick. This is Charlie. I think in this day and age of using CRM to manage patients, you hear Salesforce and Microsoft Dynamics, kind of looked at and thrown around a lot. We believe that we've really done a neat job using. We actually centralized on Microsoft Dynamics CRM, and that's what we use to manage the life cycle of a patient. But I think it's you nailed it. It's the services side. It's our people on top of the processing technology that really set us apart in the marketplace. It's we have unbelievable people in our call centers and who really while technology is important and CRM is important, what I think really sets us apart is the people that we have reaching out to the patients that you have and being. I think I heard Jim or Van mention the term extenders of your health system. I think anybody can install a CRM solution and begin to quote unquote sort of manage the patient life cycle. But I think it's our great people in our call center. I mean, that really set us apart. So health systems and hospitals and practices do an unbelievable job, caring for patients. Running a call center, running a CRM solution, that's tough. And I think that with the systems that we work with across the country, the value that they see is in the unbelievable care that we give to their patients, and the ability to use Microsoft Dynamics CRM to really manage the patient and make sure that our connection rate is huge. It's one thing to use the CRM to manage the patients. Another thing to actually complete the conversations and to do it well.
Yeah, Charlie, just to play on that, great points. And, I always go back to a CEO up in the Mid-Atlantic region who I walked in with a new employee, and I said made the introduction to the CEO, and I said, can you, Mr. CEO, share with my new colleague here what we do for you? And he said, well, we're pretty good at hiring people. We hire a lot of people in our health system, and I can throw as many nurses as I need to at a particular challenge or program. He said, but keeping in mind that as a CEO, I'm here to knock down barriers for my nursing team so they can work at the highest and best use of their license. So I chose PREMEDEX, so I can increase bedside time, increase clinical care. Number one, so I have a better use of my resources. And number two, even if I did use my resources, I didn't have a good process. So they could all tell me, oh, I did this for a patient after they left. I created X number of new appointments. I found X number of patients that may have been coming back to the hospital for a readmission if I wouldn't have intervened. We even save lives. That's the most rewarding part of our work. We save lives frequently by connecting with a patient who has been under care and is in between and moved beyond the four walls of the facility, and we detect something. And he said what PREMEDEX has, in addition to that service team, is that technology that controls the processes and the rules for how these programs work. And so, we kind of bring the best of the worlds together and can help you minimize cost associated with it. We certainly run programs for less than what internal programs cost to run at hospitals with their increasingly expensive overhead, right? So we can do it for less and do a better job and provide better data is what our clients find from us. So we're thrilled about what the future holds for everybody, excited about the recovery from COVID as we're seeing these volumes ramp up in outpatient and inpatient, and want to help optimize revenues as we move forward for our health systems.
Well, I think that sums it up well. Honestly, I think, and that's a great example because that probably says it better. Healthcare delivery has been one of the last, true relying upon brick and mortar type services out there, as so much other elements of our economy and marketplaces have moved to true, kind of breaking down some of those traditional brick and mortar walls or going outside them. But now, healthcare is moving in that direction. And I think positioning for that, not just to survive, but to thrive and to be more competitive and to take advantage of those value opportunities. That's why, that's what we work with our clients on, finding solutions. That's what makes it exciting about looking forward. So, gentlemen, I appreciate you all coming on and telling us a little bit more about what you guys are doing and seeing and experiencing out there, and also what we're looking forward to in the future. So we'll look forward to continuing the dialogue and hopefully kind of revisit this conversation in the future.
Great. Thanks so much, Mark. We appreciate the opportunity.
Yeah. Thanks, Mark.
Perfect. Thank you. Absolutely. Thanks, guys.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us in a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback, and we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.